Last month, a colleague of mine, brilliant clinician, 15 years in the field, told me she was done. Not taking a break, done. She said, "I became a psychologist to help people, not to spend 6 hours a day writing reports." And here's what keeps me up at night. She's not alone. We're losing clinicians at an alarming rate. Meanwhile, AI companies are promising to fix mental health care. But here's the question nobody's really asking. Will AI save us from burnout, or just create new problems we haven't even imagined yet? I'm Dr. Andy, clinical psychologist and founder of Impelee Scribe. And today we're going deep on therapist burnout, AI and psychological testing, and what this all means for the future of mental health care. Let's get into it. Section 1. The Burnout Crisis. Okay, let's start with the numbers, because they're brutal. A 2023 American Psychological Association survey found that 45% of psychologists reported feeling burned out. Nearly half. And post-pandemic, that number's only climbing. But here's what most people don't understand about clinician burnout. It's not just about seeing too many clients. It's about everything that happens after the session ends. Think about it. A typical psychological evaluation, the kind I do regularly, involves hours of face-to-face testing, but then 3 to 5 hours of scoring, 2 to 4 hours of report writing, chart reviews, insurance documentation, treatment recommendations. For every hour of direct patient contact, we're spending 2, sometimes 3 hours on paperwork. In practice, what we learn from school is far from what we do on the job. We didn't go to school for 8 to 10 years to become documentation specialists. We did it to understand the human mind, to help people, to make a difference. And yet, here we are, drowning in paperwork while clients wait weeks, sometimes months, for appointments. So when AI companies show up promising to revolutionize mental health care, you can understand why clinicians are listening. Section 2. AI's Promise Thee. Now let me be clear, I'm not anti-AI. Far from it. I founded Impelee Scribe specifically because I believe AI done right can genuinely help. Here's where AI actually shows promise. First, documentation assistance. AI can transcribe sessions, generate draft notes, and help structure reports. This alone could save clinicians hours every week. Second, scoring automation. Psychological tests like the WAIFA, the BAESC-3, or the Brown Executive Function Scales involve complex scoring algorithms. AI can handle these calculations in seconds with fewer human errors. Third, pattern recognition. AI can help identify patterns across large datasets that humans might miss. AI can identify potential risk factors, treatment response predictors, diagnostic considerations. Fourth, accessibility. AI-powered screening tools can help reach underserved communities who might never set foot in a psychologist's office. As someone who immigrated from Ghana and understands firsthand how mental health resources are distributed globally, this matters. When AI handles the mechanical work, clinicians can focus on what we're actually trained for: clinical judgment, therapeutic relationships, nuanced interpretation, and human connection. That's the promise. And it's a real one. And you knew there was a but coming. Section 3, AI's Peril. The concerns. Here's where we need to pump the brakes. Concern number 1, over-reliance. When AI generates a report draft, there's a real temptation to just accept it. Click approve, move on to the next case. But AI doesn't understand context the way clinicians do. It doesn't see the tremor in someone's hand during block design. It doesn't notice the cultural factors that might explain a specific response pattern. If we stop thinking critically because AI is doing the thinking for us, we're not helping our clients. We're failing them. Concern number 2, Training data bias. Most AI systems are trained on Western, English-speaking, predominantly white populations. What happens when these tools encounter someone from a different cultural background? Someone whose expression of distress doesn't fit the expected pattern? I've worked with clients from all over the world. The way psychological symptoms present, the way people describe their experiences, it varies enormously across cultures. AI trained on narrow datasets will inevitably pathologize normal cultural variations or miss genuine distress that presents differently. Concern number 3. Privacy and confidentiality. This one keeps me up at night. Psychological data is among the most sensitive information that exists. Diagnoses, trauma histories, cognitive profiles. When we upload this to AI platforms, where does it go? Who has access? How is it stored? Many popular AI tools were not built with HIPAA in mind. They weren't designed for clinical settings. Using them with real patient data isn't just risky in many cases. It's potentially illegal. This is exactly why, when building Impelee Scribe, privacy wasn't an afterthought, it was the foundation. Tokenization of protected health information, no storage of identifiable data. Because if we can't protect our clients' information, we have no business using these tools. Section 4. The future of psychological testing. All right, let's zoom out and talk about where this is all heading, specifically in psychological testing. AI is already here in assessment. Automated scoring has existed for years. But we're entering a new phase, AI-generated interpretations. Imagine uploading raw test data and receiving a fully assisted written psychological report. It's not hypothetical tools like this exist right now. Here's what AI can realistically do well in testing. 1. Calculate scores accurately and quickly. 2. Generate standardized language for common findings. 3. Flag statistical anomalies or unusual patterns. 4. Streamline the mechanical aspects of report writing. See it as a documentation assistant and you as the professional in charge. Because AI cannot do 1. Understand why someone performed a certain way. The qualitative observations that inform interpretation. 2. As we all know, integrating collateral information is very critical for accurate diagnosis of certain mental illnesses, e.g., ADHD, dysthymia, schizophrenic spectrum, etc. Family history. Medical records and behavioral observations all provide a full picture. 3. Make judgment calls in ambiguous cases. And let me tell you, most cases are ambiguous. There are blind spots in structured clinical assessment versus real-life functional abilities. And some cases, regular counseling therapists may accurately track behavioral concerns or maladaptions or symptoms. 4. Communicate findings with compassion. Delivering a diagnosis isn't just information transfer, it's a human moment that requires sensitivity, cultural awareness, and clinical skill. For example, start with the individual's strengths and move to areas of opportunities for improvement. Providing community resources and relevant referrals is very critical for patients and their caregivers. The clinicians who will thrive in this new landscape aren't the ones who resist AI entirely. And they're not the ones who hand over their clinical judgment to algorithms. They're the ones who learn to use AI as a tool while remaining the expert in the room. Section 5. Practical guidance. So what should you actually do with all this information? If you're a clinician exploring AI tools, here are my recommendations. 1. Vet the privacy practices. Before using any AI tool with client data, understand exactly where that data goes. If you can't get a clear answer, walk away. 2. Never skip the review. AI-generated content must be reviewed line by line. You are the clinician of record. Your license is on the line. 3. Maintain your skills. Don't let automation atrophy your clinical abilities. The day the AI fails, and it will, you need to be able to function without it. 4. Advocate for ethical development. Support companies and tools that prioritize privacy, cultural competency, and clinician oversight. The market will follow demand. 5. Set boundaries. AI can help with burnout, but only if you use the time savings for rest and clinical work, not just more clients. Protect yourself. Before we close this topic, as part of my commitment to contributing to knowledge and reflective psychological testing and writing practice, I have published a book, Beyond the Numbers, Psychological Testing and Report Writing in the AI Era. Click on the link below to learn. Here's the bottom line. AI isn't going to save mental health care on its own. And it isn't going to destroy it either. What happens next depends on us. The clinicians, the developers, the advocates. We have a choice. We can let technology be built for us, without our input, or we can shape it ourselves, grounded in our values, our expertise, and our commitment to the people we serve. I know which path I'm taking. If this video made you think, subscribe to the Insight Lab. We go deep on AI, psychology, and what it means to be human in an increasingly automated world. Drop a comment below. Are you using AI in your practice? What's working? What concerns you? I'm Dr. Andy. Thanks for watching, and I'll see you in the next one. Click the subscribe button for more insight.